want to learn some things about your GI tract and health and how things work in your gut. Let's just go ahead and get started, okay? So we're going to be talking about just some common things seen in functional GI distress. So some of you've probably had some of this, bloating, acid reflux, frequent or chronic abdominal pain, chronic diarrhea, constipation, loss of appetite, frequent belching and gas, and fatigue. There's probably some other things that could go along in here, but those are the primary ones that I see. A lot of these symptoms are not necessarily diagnosable through common diagnostic medical tests. For example, I see a lot of people that come in here with GI issues that have had colonoscopies and endoscopies, and they didn't find anything. I mean, and that's a good thing they didn't find anything, at least rules out things like colon cancer, ulcers, or things like that. But a lot of these problems that people have are dysfunctions, they're not pathologies. Now, can a dysfunction eventually lead into a pathology? Yes. Okay, in fact, all pathology in the body starts out as a dysfunction that's just let go, just on and on and on until finally it becomes a disease process. And then if you have a disease process in the body that's that you just let go on and on and on, that eventually becomes autoimmune. And that becomes an autoimmune issue in the body. So what we want to do is catch these things in the dysfunction process. Now, functional medicine, we look for the root causes of problems. So, diseases like diabetes, cancer, heart disease, obesity, autoimmunity, fibromyalgia, arthritis, they all have root causes that produce these things here as symptoms, like immune imbalances, structural imbalances, inflammatory imbalances, hormonal imbalances, toxic chemical exposure. We'll talk about that a little later. Digestive imbalances, mitochondrial dysfunction. By the way, what is, anybody in here tell me what mitochondrial dysfunction is? Anybody know off the top of their head? I mean, I've talked about it in some of my talks.
Is it something to do with the heart?
There's a lot of mitochondria in heart muscle, but it's all over the body.
Okay.
So what do mitochondria do? Anybody know?
Converts the sugar into energy.
Great answer. Yeah, they produce energy, right? They produce ATP. Okay? So mitochondrial dysfunction, the very basic level, is basically impairing your body's ability to produce energy. So what happens then? What happens when your body can't produce energy?
Fatigue.
Fatigue would be one. That'd be a symptom for sure. Absolutely. What else?
Weight gain.
Weight gain? Yeah. Okay. What else? Your body needs energy in order to fight disease and heal. Okay? Can't do that without energy.
Right.
Okay? So if you look at some of the most recent research on cancer, and I talk about this in my cancer talk, because cancer is basically a disease of the mitochondria. It's mitochondrial dysfunction. Okay? So what causes mitochondria not to function right? Anybody? Anybody know? Nobody knows.
Your
Diet?
diet.
Diet would be could be an issue, certainly. Okay. Number one is their toxicity. They can be poisoned. Okay. So for sure, toxicity. And what about nutritional imbalances? Your mitochondria needs certain nutrients in order to work right, like vitamins and minerals and things like that. So that would be an issue there. What would cause inflammatory imbalances?
No exercise, or?
Yeah, that'll produce some inflammation. That's not what I was thinking of, but yeah, lack of exercise
I think I just read too many carbohydrates can cause inflammation.
Sure, yeah, too much sugar.
Too much sugar.
Yeah, too much sugar. How about
Allergies.
allergies?
Yeah.
Which allergies are probably would be a problem up here caused by a root cause down here. So like food intolerances
Right.
would be like being intolerant to a food would cause an inflammatory imbalance.
Okay.
That would definitely, and inflammatory imbalances and immune imbalances are very closely linked together. Okay, probably spent enough time there. So common issues frequently seen in patients with GI distress. Low stomach acid, okay? Low stomach acid, we just don't produce as much as we get older. And in this country, we tend to overeat and we eat too much processed food. Now, I know during the holidays, none of you guys ate processed food or sugar, but there's some people out there that did, okay? So they're out there, okay? But yeah, stomach acid, we just overeat, and that lowers stomach acid. Inadequate pancreatic enzyme production from chronic stress on pancreas. So pancreatic enzymes assist in the digestion of both protein and carbohydrates. So when we talk about stressing the pancreas, what would do that?
Too much sugar?
Too much sugar, definitely. That would stress part of the pancreas.
Sometimes medications like statins will stress out the pancreas.
Yeah, statins cause elevation in blood sugar.
Right.
As lots of medications cause that, like steroids cause that as well. But again, if you eat too much protein or too much carbohydrate, that's going to stress out the pancreas. That's why we need a balanced diet. That's why I like the Mediterranean diet, because it's very balanced. Gallbladder removal or gallbladder dysfunction due to eating too many processed fats or the standard American diet. So there's a lot of surgeons that live in big houses, and all they do is take out gallbladders. And the reason they do that, the reason people get gallbladder dysfunction, is that we just eat the wrong kind of fats and way too much of it, okay? And so gallbladder removal causes a lot of GI issues. I mean, do you think the gallbladder is in there for a reason? It's not just in there so surgeons can live in big houses, okay? It's in there because when we eat fat, our body has to process it, okay? Anybody else know what the gallbladder does besides process fat? What else it might do?
Well, it secretes bile that helps with digestion.
Right?
Yeah.
It does that.
Yeah.
And it secretes bile salts, which are a storehouse for body alkalizers. So when you drink the Kangen water, you're alkalizing your body, but bile salts alkalize the body too. When you lose your gallbladder, you lose the ability to alkalize your body as well. And your body tends to become acidic, which can lead to more health issues down the road. So chronic food intolerances, number 4, including wheat, gluten, dairy, soy, peanuts, eggs, can be anything, okay? So this is another typical GI dysfunction, okay? And, I could have put a 5th one, probably should have, just dysbiosis due to too much medication. And it's one of the primary causes of dysbiosis.
Yeah.
Can anybody name me some of the medications that would cause that? One's really obvious. You ought to know that one in your sleep.
The NAIS.
NSAIDs.
NSAIDs,
Yeah, good job. That's very good. Yeah, NSAIDs do. So
Xanax.
what?
Xanax.
Xanax, yeah. So So these are medications that disrupt gut flora. One I was thinking about on the top of my list, antibiotics.
Yes.
Oh, yeah.
They are bad for that.
Yes,
Antibiotics,
they definitely
okay?
Yeah.
So, but NSAIDs, like people that take things for pain a lot. In fact, there's a patient I was really hoping would be here tonight to hear this, but that's okay. Patients, like when you get pain, you take ibuprofen, you take acetaminophen. They really disrupt gut flora a lot. Steroids disrupt gut flora. So when you take steroids, bad news for gut flora. So there's a lot of things that we do, and then a lot of the preservatives in foods are bad for flora. And processed foods are really bad for gut flora. So a lot of the things that we do in America on a routine basis, just people do it every day. It's one of the things that causes a lot of the gut dysfunction. So Robert Lustig, I have his book back in my office. I really like this guy a lot. He's a pediatric endocrinologist. He's written 3 books. His first book is called Fat Chance. I haven't read that one. His second one was The Hacking of the American Mind. I've read that one, and I actually do an entire talk based on some of the information in his book. The third book he wrote, his most recent book, which I read last year, is Metabolical, and it's a play on diabolical. And he just talks about how the health, our traditional healthcare system, and our food industry is making people sick. Okay, so he says 2 things throughout his book which are really important. He says, you want to stay healthy, you got to feed your gut bacteria, you got to protect your liver. He says this over and over and over. So you feed your gut by eating unprocessed fruits, vegetables, nuts, and high fiber foods. So real food, okay, that's grown, and you protect your liver from glucose, fructose, omega-6 fatty acids, which is in most processed foods and very high in commercially grown meats. Too much iron and oxidative stress, which is toxicity and food additives. What's another very common toxin that is associated with American food that we probably ingest all the time without even realizing it? And it's one of the things that actually poisons our mitochondria, it disrupts our hormones. Anybody know?
Glyphosate?
Glyphosate would be one. If you're eating organic, probably not very much glyphosate, but you can even eat organic and get this in your diet. But that's a good answer. That's a really good answer. It's even more common, way more common than glyphosate. I'll give you a hint. It's not a pesticide or an insecticide. Okay. It's so obvious. You're gonna go, oh, I could add a V8 when I tell you that.
Soy?
Okay, what?
Soy?
Not soy.
Soy.
It's plastic.
Oh.
Plastic. I mean, when we go to the store, we buy meat, we buy anything. What's it in? Plastic.
Yeah.
Plasticizers. They're so bad for people. And when I do my talk next year on toxicity, I'm going to spend a little time on talk about all the things that plasticizers do to the body, which aren't good for them. Okay, but they're really hard on mitochondria. Well, we plastic and everything, I mean. So
How would you get away from it?
it's hard. I don't know. That's a really hard.
I mean, I try to store stuff in the fridge in glass.
Yeah,
and
well, that's
I
one
try
way.
to cook in glass or
Cooking glass or
Stainless steel.
iron or stainless
Yeah.
steel.
Yeah.
Yeah, exactly. Those are some good ways. But
the plastic packaging is everywhere.
yeah, it's everywhere. You can't get around it. The only way you can get around it is like almost where you almost have to live off the grid and grow all your own food, raise all your own food. Then you can get around it.
Right.
But who can do that?
And that's hard to do.
It's hard to do.
Yeah.
Yeah. So just remember this: feed your gut, protect your liver. What do most people in our country do? If you look at this,
The exact opposite.
the exact opposite. We flood our liver with omega-6 fatty acids and sugar and processed food, and we destroy our gut bacteria with pharmaceuticals and a poor diet. It's exactly, this is why everybody's sick. This is what Lustig says in his book too. This is why everybody's sick, because everybody's doing the opposite of that. And so if you can just remember that, feed your gut. Now, does this mean that you can never eat any unprocessed food, any processed? No, it doesn't. Does this mean you can never have another Christmas goodie again? No, you just can't live off of them, you know. This can't be a major part of your diet. So processed foods, high sugar, low fiber, does neither of the things that we talked about before. It's a primary suspect in our current health care debacle. And a diet high in processed food is like eating very slow acting poison. It poisons your body over time. Now we've got specific nutrients in our office, plus dietary changes. This is Colacol. So anybody in my office that doesn't have a gallbladder needs to be on Colacol forever.
Yep.
Okay.
Yep.
Because Colacol is bile salts. It gives your body the bile salts it needs to help emulsify fat. Then you be on it forever. And even people that have gallbladders aren't working very well do a lot better if they take Colacol. This is IPAN, which is basically helps with hydrochloric acid. And there's some other things we could talk about.
What is that one on the right?
You know what? I'm not even sure.
Digest Forte.
Is it Digest Forte?
Mhm.
I don't know. It might be.
Oh, okay.
Digest Forte is one of my favorite products, actually. It helps the body do all the things it needs to naturally, endogenously.
So it's got the enzymes in it.
Well, it does, but it's an herbal formula that causes, your stomach to produce more acid, your pancreas to work better from a digestive standpoint, your gallbladder secrete more bile. It causes the body to do the things it's supposed to do. Mm-hmm. Okay. Now let's talk about SIBO. Now SIBO was originally thought to be, a simple overgrowth or reflux of large intestinal bacteria into the small intestine, and it is that somewhat. If you look at the intestinal tract, bacterial contents in the intestinal tract increase in concentration as they get closer to the rectum. So your large colon is a lot more concentrated in gut bacteria than your small intestine, and far more than your stomach, which, if your stomach's secreting acid properly, bacteria shouldn't even be able to live in your stomach, or not very high concentrations. So in the small intestine, bacteria are responsible for absorption and synthesis of nutrients and protection against pathogenic bacteria and yeast. So all of us in our gut have candida, we all have different kinds of yeast, we all have a lot of pathogenic bacteria, but we have them in very small amounts so they don't hurt us, okay? It's when they get out of balance that they cause a problem, and we need that. We need small amounts of what we call pathogenic bacteria. It's important in the gut ecosystem, but it's when that gets out of balance. It's like, when all the good people move out of the neighborhood and the bad people move in, then you got a problem. Well, that's the same way with the gut. In the large intestine, bacteria are much denser and more diverse. When bacteria from the large intestine invade the small intestine, so changes occur which aren't good, okay? So the small intestine is not designed to handle the bacteria that's in the large intestine. So when that goes backwards, you get leaky gut, you develop food allergies, nutrient deficiencies, inflammation, and impaired peristalsis.
What's peristalsis?
It's the body's ability to push food through the GI tract, and you got to have that.
So that's constipation.
Yeah, or you can get constipated, right?
Yeah.
Yeah. So when bacteria from the large intestine, let's see, we just got, okay, so SIBO occurs when you have this abnormal colonization, and it alters function, can alter the structure and the ecology of the small intestine. So you can also get what's called SIFO, small intestinal fungal overgrowth, which occurs when intestinal candida changes into its fungal form. Now, what do you think might cause this?
Sugar?
Well, sugar would feed it, but
Oh.
I don't think sugar actually causes that. But you're on to the answer that for all of my questions,
Oh.
sugar. But that sugar's not the answer to that one. Okay. So what do you think would cause this to happen? When candida changes to its fungal form?
Probably antibiotics. Or
Yeah.
steroids.
That's good. Good, very good answer. Antibiotics and steroids, yeah. Pharmaceuticals. That's what causes that. You know, pharmaceuticals are the primary cause of yeast infection in human beings. You know, now sugar feeds it. I mean, if you got a yeast infection, you eat a lot of sugar, you're going to feed that. But sugar doesn't really cause yeast infections. It promotes them, but it's usually pharmaceuticals that do that. So bacterial waste in the form of hydrogen methane or hydrogen sulfide gas, what happens is, so when you get this reflux of bacteria in the small intestine, it starts producing gas. And it takes 24 hours for the gas to be diffused through the blood and let out of the lungs. So you're pretty miserable during that 24 hours. You can't pass gas, too high to pass gas, too low to burp. Okay, so you're stuck with it until it comes out of the lungs. Okay? So most common SIBO symptoms: bloating within 30 to 60 minutes of a meal. Bloating is worse at the end of the day. You cannot eat fermented foods like sauerkraut, kimchi, kombucha. It'll set it off immediately. You can't do probiotics, prebiotics, garlic, onions. Your body cannot tolerate that. And you have chronic constipation and or chronic diarrhea. Okay, signs to watch for. So you get up in the morning, you feel fine, and then you start eating foods, and you start bloating towards the end of the day, and you feel miserable at the end of the day. So let's say that you think you might be gluten intolerant. You adhere to a strict gluten-free diet, no improvement. Could be SIBO, okay? Development of chronic GI symptoms after taking PPIs or acid blockers. Could be SIBO, okay? Presence of fat, fecal fat. You cannot gain weight. But here's a big one, huge one. History of food poisoning, bowel surgery, or opioid use are big promoters of SIBO. So these people that get these surgeries where they shorten the bowel and all of that can be a big cause of SIBO.
What is fecal fat?
Too much fat in your feces.
And you can see that?
Yeah. Oh yeah. You can see it.
Really?
Yeah. You shouldn't be. You shouldn't be loaded with fat. Your body needs to digest fat and process it, and if it can't do that, yeah.
So SIBO, that's what SIBO causes.
It
that.
could be. Yeah.
It could be.
What are the best tests for discovering if you have SIBO? I'd recommend a combination of these. Probably breath test with one of these two, and I'd probably go with 1 and 3. breath tests test for the hydrogen and methane. So if your body's producing that, you know, and you're going to be breathing that out, some of it's going to come through your breath. And then organic acid testing is very powerful. It's a urine sample. It really evaluates yeast, fungal overgrowth, mitochondrial function, all kinds of different, your ability to detoxify. Organic acid testing is great for that. It's a great test. Shows all kinds of things that go on in human function. So these are the, I would probably do 1 and 3, okay? And then treat according to that. So there's no perfect diet. So I'm going to show you the diet that we use, plus some of the herbal therapies that we would use to fix it. So you have to avoid these foods. Anything that's fermentable by bacteria in the large bowel. Now I'll go through what these are here. So it's called the FODMAP diet, okay? So oligosaccharides, so that's here. Oligosaccharides are wheat, barley, rye, onions, leeks, legumes, lentils, artichokes, cabbage, mushrooms, sweet corn. Monosaccharides, honey, mango, like basically a lot of fruits. Avocados, watermelon, high fructose corn syrup, and polyols, apples, pears, apricots. So these are all pretty fermentable in the large, so you can't have any of this.
Oh.
You cannot eat this. Okay? So
Well,
you
that would go my diet completely.
yeah, so you'd be eating you'd be eating meat, and so these are high FODMAP foods. Let's see. Yeah, these are things that you have to avoid. So yeah.
What can you eat?
Well, you know, you're going to be eating meat, and you're going to be eating some vegetables for sure. You know, sprouts, green leafy vegetables, things like that.
Now, I noticed that apples makes it onto 2 of those lists.
Yeah.
Monosaccharides and polyols.
Yeah, because apples have sugar.
Oh.
Yeah, they have fruit sugar.
So what's a polyol?
Polyol is just a chemical that appears in certain fruits. Okay, yeah. So we use the biphasic diet. So you reduce the fermentable starches, repair the damage to the gut lining with specific nutritional formulas, which I'll show you in a minute. You remove overgrowth bacteria and fungi, and you restore normal motility. So this is what I would put people on right here. We haven't been able to get gut flora complex for a long time, but they're going to have it here in the new year. So you go day 1 through 4. This is what you'd have. Day 5 through 9, and then day 10 through 14. And then you'd repeat that. And it might take 3 to 6 months of this to fix it. Okay?
Now, what happens if there are some of those things that you're mentioning that are a factor, but there are other things that are not?
What do you mean?
Okay, so like I can do the fermented foods. I take sauerkraut.
Okay, so you can eat
fairly
fermented
regular.
foods.
Yes.
Okay, and no problem.
Right.
Okay.
And I eat Brussels sprouts. Now, I don't want to overdo it.
Mhm.
I know when I've had too many,
Okay.
and then I'm not happy.
Okay. So you probably, I don't think you've got SIBO.
I don't think I do
No,
either.
I don't think you got SIBO. Because remember that the biggest symptom of SIBO is by the end of the day you feel miserable. You keep bloating and bloating and bloating, and then it just takes time for that all to diffuse out of your lungs. So I don't think you've got that, Christine.
No.
You may have some food intolerances and you may have some dysbiosis, but I don't know that you've got SIBO.
Yeah, I got chemical issues going on.
Yeah, and probably a lot of us do too,
Yeah.
really, when it comes down to it. So other strategies that may be required for SIBO, like a prokinetic, which is something to help move things through. Ginger is really good for that, okay? And you can, like, in our household, we get ginger root, especially in the wintertime. We peel it, we put it in a little blender with some water and puree it, and then we put it in boiling water and boil it. Then we strain it, we make ginger tea, and you use that with some lemon juice, and it's really good and really good for you. Very powerful anti-inflammatory. I mean, you know, I can get ginger root in a, you know, in an herbal formula here, but I mean, you don't even need to do that. You can make your own ginger tea and add some lemon juice to it. It's really good, and it's very, very healthy. You know, biofilm busters. You know, lactobacillus may or may not work with SIBO, but nattokinase, proteolytic enzymes, that's probably what I would use. Probiotics may be required, but definitely if you've got yeast and fungal overgrowth, I have a product called ADP, which is primarily oregano oil and grapefruit seed extract. We have, you know, the other one that's good for this is powdered garlic. Works really well for yeast and fungal support. So I would probably use some of that. Good. I think, any questions on anything I've covered? Yes.
Back to acidic and acid, like your digestive tract needs to be more acidy, or not acidy, but have more acid to break down the
Your stomach needs acid.
acid.
Yeah, and then as it moves through, it becomes alkaline, and then in the lower GI tract, I think it becomes acid again.
Okay, so the difference between we need the acid in our stomach, but acidic, we don't want our digestive tract to be too acidic.
Right, too acidic or too alkaline.
Right. So that's probably a hard balance to have, isn't it?
Not if you're eating a healthy diet.
Okay.
If you're eating a healthy diet, it should work just the way it's supposed to.
Yeah.
It's a hard balance when you flooded your body with pharmaceuticals,
Right.
and you haven't eaten very well.
Yeah.
Then you're going to have issues.
Okay.
But if you're eating a good diet, you shouldn't have a big problem with that.
Okay.
No, you should be fine. Yes.
What about acid blockers? What negative effects can happen from acid blockers, like Nexium?
Lots of negative effects. First of all, you need acid to break down protein. A lot of that's done in your stomach, but you can't do that then. You can't break down protein. Acid in your stomach is really important for keeping bad bugs out of your body that you ingest. The acid's supposed to kill them. Well, if you're taking those acid blockers, you don't have that ability. You lose that ability. So also, when you digest food, when the acidic food goes from the stomach into the duodenum, the small intestine, the acid in the food from the stomach actually stimulates the duodenum to produce pancreatic enzymes in order to digest the food. Well, you don't have that nearly as much either. So there's a lot of really negative effects from acid blockers. And I don't, I realize there's some people that if they don't take them, they get symptoms. But I think I just think that you got to go back to what was the cause of having to take those things in the first place. What happened that you had to, use acid blockers? Because most acid problems in the stomach is not too much acid, it's too little acid. So, you know, and they just assume that, you know, they give an acid blocker that'll take care of it. They're giving acid blockers to babies now that spit up. That's absurd.
No, why would you?
That's insane.
I mean, even my son had a really bad case of reflux when he was a baby, but I would have never given him that.
Yeah. So, you know, if they're having reflux, I mean, I don't know if I answered your question or not. I hope I did.
What would be the alternative then?
I would try something like Digest Forte and see if that would help normalize things. You know, try that. I don't know if have you tried that?
No.
He
Okay.
hasn't, no.
There was another one that was an alternative to that, which I'm on. That starts with Z.
Zypan.
Yeah.
Yeah.
Zypan. Yeah. And so that's another alternative that I use. Zypan works pretty well, but you know, Digest Forte would be a good one. You know, some people do better on Zypan, some people do better on Digest Forte, but anything to get the body working like it's supposed to work, you know, is the key for me. And you know, and we start kind of manipulating the physiological processes in our body with pharmaceuticals, all kinds of bad things can happen. Yeah. And I mean, I'm not saying people should never use pharmaceuticals. I'm not saying that at all, but I just think that we've just really overdone it in a lot of ways. And so we've created like a lot of this here, and I've seen that. So,
May I ask one more
yeah,
question?
yeah, you bet.
For acid, some people take apple cider vinegar, the Bragg's. Is that good or bad?
It's great. I take it all the time.
Oh, like how many times a day do you take
I
it?
take it before bed.
Oh, do you?
Take 2 tablespoons before bed, and I chase it with water
Is that right?
every night, unless I forget, which I do sometimes.
And you do that, why?
Because it's really good for digestion.
Mm-hmm.
It's just a good tonic.
Mm-hmm.
And I've read that it's a good sort of a natural, I hate to say it antibiotic, but it kills bad bugs.
Mm-hmm.
And so, yeah, I do it, and I feel better when I take it at night.
2 tablespoons.
2 tablespoons, that's what I take.
Mm-hmm.
Yeah.
That might be too much for some of us.
Yeah, okay, yeah, it might be. So
But
start
you
out with
know-
a teaspoon, you know?
Right.
I mean,
Mm-hmm.
Well, you know, I put a splash of, I don't do this all the time, but I do frequently put a splash of the apple cider vinegar in a cup of water, and then I add a splash of cranberry juice.
okay.
Not the sweetened, but just the
Yeah,
plain.
that's good. That's
And
a
it
good
it
strategy.
works.
Good for
Tastes good
urinary
together.
tract function, and yeah, it's good.
One more question I have.
Yeah.
When you talk about sugar, there's so many sugars now that, like stevia, monk, xylitol. Do those fall in the same category as the sugar you're talking about?
Not really. I mean, monk fruit is not bad.
Okay.
It's, you know, and stevia, I mean, it depends on who you talk to about stevia. You know, we use it at our house.
Mm-hmm.
I don't use a lot of it personally. And if we're going to sweeten something that we're going to bake, we usually use coconut sugar.
Okay.
Coconut sugar's pretty good.
Yeah,
Mm-hmm.
that's what we generally use.
Okay.
I'm not saying that we would never use brown sugar,
Mm-hmm.
but not that much.
Yeah.
Right.
And we don't, you know, and I don't sweeten things up very much. I usually try and make things sour rather than sweet.
Sure.
So,
But does that sugar fall into the category of what you're talking about, leaving sugar out of your diet?
not
No,
really. I
not
don't think stevia does at
Okay,
all. I don't
okay.
think monk fruit
Okay.
really does.
Or coconut sugar?
You know, coconut sugar is probably, I would be more careful with that.
Okay.
Because it's sweet, but
Sure.
you have a lot of minerals in it too, which is really good.
Okay.
So I'm cautious even with coconut sugar.
Okay,
But that's what we use. If we're gonna use a sugar to make a dessert or something,
sure,
we'll use coconut sugar.
okay,
And, you know, sometimes Velma will throw in a little brown sugar, you know, occasionally, you know, but not very often. We don't use it that often. I use brown sugar primarily to ferment kombucha tea, you know, as a fermenter for kombucha. And it'll ferment all the sugar, and then it'll make the sour fermented tea. So that's really what I use brown sugar for mostly.
okay.
So yeah, good. So some of you guys may know some people that have SIBO, and there's hope for that, you know. And you know, we just need to do the right testing, give them the right products, and get their bodies cleaned up. And there's hope for people like that. And sometimes it takes time. They've had it for a while. It may take time to fix it. You know, it's the longer you've had something, generally, this isn't always the case, you know, it takes a while to get it better. It can. You know, I've seen some miracles happen, like, you know, where, you know, it's really fast, but that doesn't always happen like that, unfortunately. Good. Anybody else?
You said that you would send the
Slides.
slides. I get emails from you all the time, so you got my email address, so that would be adequate, I guess, but I'd sure like to.
Yeah, so if you want a copy of the slides, just write your name down here. Well, that's the January 10th. Just give Carmen your email address, and or your name. We have your email address. I'll send you the slides in an attachment. And okay, good. All right, great. Thank you so much for coming. Our next talk is January the 10th, right, Sarah?
Yes.
And that's a talk I've never done before. Really good talk on how posture affects health.
Everybody sit up.
Gonna be a great talk. Yeah.
Yeah.
Sit so straight, yeah.
Okay.